manage to grab a quick drink and comfort break. We've got about half an hour left on our allocated time with 2 substantive items. So I feel as chair we can have enough time for people to ask questions and discuss what we need to in those items. I know there are others, so let's get going. So one of them, David, belongs to you, item 230, becoming anti-racist. Over to you.
Yeah, thanks, Chair. I made the assumption that everybody's read the paper that's in your pack, giving the latest update, and I would like to think that board colleagues are pleased to note that we're starting now to see the impact of a number of measures that we've taken through those task and finish groups around board leaderships. They've started to impact on the National Staff Survey data. Because the staff survey is still under embargo, we've not included the full suite, but we have sneaked in a couple here for illustrative purposes in this particular report. I think there's a recognition that the anti-racism programme was a commitment by the board, and there was a support from the board leadership development programme, which led to those executive and non-executive directors taking leadership of all of those programmes. But because of turnover, we're seeing a number of execs and non-executives leave the organisation. So as new people have come in, they might not quite understand the context of the programme. So I think what we're doing in this report is signalling it's an opportune moment to rethink the governance model that underpins this programme and the infrastructure that supports it. So we will be bringing something back to board in relation to that. And it would be remiss if I just didn't finish this report by just thanking Bruce for his huge commitment, passion and dedication to this agenda over his time working at the Trust. I think Bruce has been hugely challenging to work with for all the right reasons, because he really has been a champion, an ally, and working really hard to further the anti-racism agenda. And I will miss you as a Ned, and I will miss you as my counterpart on the Conduct and Capability Group. Thank you, Bruce.
Thank you. I'm going to open it up. The report speaks for itself. I think particularly paragraph 17 on page 151, which is where you say, David, the board now has a task to sustain the improvements we've done today. Action must be taken forward with equal energy to ensure that this change is embedded within the Trust and our values, culture and leadership. That's the thing that jumps out at me on this report. Jeff?
Thank you, Chair, and I'm very happy with this report, and I've got a sort of parallel question to ask, which I'm happy for it to be answered out with it today because it's complex. But I take this report to be very inward-looking and focused on cultures and behaviours of the people of this organisation. We heard from Kate before about inequalities, and it's clear that inequalities affects ethnic groups in different ways. And as well as looking inwards, we need to look out at our patients. And I wondered at some later date, can we have a conversation about, because I'm minded to note the institutional and structural racism that's built into this country. And it's very, very much in the focus in the media at the moment. And I'll quote one thing. There was a report from the Race and Health Observatory, which sparked my interest in this last week, the ethnic inequalities in healthcare, a rapid evidence review. And I read that and I thought we've got to do something about this. So I just, thinking about our inequalities, I think we should be mapping our inequalities against ethnicity as well. We classically do it against deprivation, don't we? That's what we go to. That's what we're aware of. But I think we need to expand that and make our analysis more granular.
Okay. So thanks, Jeff.
Do you want a really quick response to that? So I met with Hannah Chandersingh earlier this week on resetting and reframing our approach to the anti-racism agenda, as Dave's alluded to in the report. And one of the challenges, there are 2 pieces of work now that we're progressing, well, 3. One is the recommitment, kind of re-engagement of the board on this agenda to kind of structure the work programmes and push from here, which is great. The other is we're going to be doing some work with Yvonne Coghill, who's one of the national leaders in this field, ex-national lead, kind of very senior chief nurse, which will start with a board workshop to kind of refresh, re-engage and go again, because I think there's more we can do, and it's great and encouraging, but we could go so much further with this agenda. And the conversation with Hannah was exactly that, is to look at kind of the access to healthcare, the patients and community we serve. And, you know, Kate alluded to it a little bit in the way that we use AI and the data robots to look at the risk factors in our waiting lists, which is going to help some of that inequalities. But again, we can go further. So I absolutely agree with Dave and Jeff. It's a good start. It's taken us 3.5 years to start to see some improvements in the survey. So I just want to set the board's expectations of how much this isn't done yet. But the more that you move the dial, the more that you move the kind of the big stone, it's going to build momentum. So we need to commit to that again.
Sarah?
Thanks. So actually my question almost follows on from that. As I said, it's taken that long to get here and we need to keep moving forward. So I think it's good to see the progress that's been made. And my question really is, how will we know if that's actually happening? So for example, 11A is recruiting, recruitment panels must be diverse. How will we know if recruitment panels are diverse? So what will be the measures that we can measure, sort of track against?
David, I won't ask you to respond to that. I'm assuming that that's the work of the 5 subgroups that are working in the area of race. But if you could take that back as a comment, if we take the chief exec's one, you know, speed and pace, and the second one, when will we know and what evidence are we using on attainment? Yeah, and I think the only other thing, we take on board your point as well, Jeff, around ethnicity as a thing around population health, etc. I would also make a request both for the board and Lorraine as head governor, the Council of Governors as well, that we probably need to just look at ourselves and our own makeup, because we're very predominantly a white board and very predominantly a white Council of Governors, and we need to just make sure that we give enough space for colleagues from diverse backgrounds to have a voice here. And I am conscious that, particularly around ethnicity, we are short in the board. We need to look at that. Sarah?
Thanks. It was just a follow-up comment, which is that the phrase just a learning culture is used throughout, and just culture, and I don't really know what that means. So I don't know if this, at some point, I'm not asking you to answer that question now, but if at some point we can just understand a bit more what we do mean by that in terms of the culture we're trying to create.
Yeah. David, you want to come in on that?
I think it will become really evident in the next agenda item, actually, Sarah, but I think there's a need to educate, upskill everybody, because the just and learning approach is very different to an approach that's hardwired into most people. So we really do need to do the reset. So I think that question, I've heard the phrase, what is it, is one that we're going to be having to take out really quickly over the next few months as we make just and learning and restorative approaches the key to the culture at Morecambe Bay.
David, with your permission, I'm going to also suggest that we minute into the board that the non-exec directors, which meet formally every month, we have a session on that just and learning approach with the NEDs, please, from somebody from your team. Okay. Thank you, David. Thank you. We're asked to consider the progress and impact of the anti-racist programme. We've done that, particularly in relation to the cultural transformation. There's a bit of a crossover to the next item there, and how these programmes should progress. We've done that hand in hand to ensure sustainability of improvement and continuous positive outcomes, while also providing intensive support to address poor experience. Sorry. Yep. Colleagues happy, thank you. Item 231, still with you, David, Director of People and OD. Clever together.
So thanks, Chair. There is a presentation in the in your board pack.
Have it.
I'm just. Can you see the big presentation now in front of you?
It's come through, mate.
It has come through, is it?
Yeah.
Okay, fantastic. Thank you. So I'm not going to go through all of the slides in that pack because of time, but I want to take us through some of the key ones. I do want to leave an opportunity for questions as well. But just to to reiterate, a cultural leadership programme commenced in September as part of the recovery support programme, albeit there was a cultural transformation board in place prior to then. And we've really used the expertise from that intensive support team nationally to pause, stock take and build a programme that's going to embed and sustain cultural improvement and lasting transformation. And part of that is around really engaging with colleagues around the culture of the organisation, what it feels like to work here, and what the priorities and actions are necessary. There's a range of principles and sort of an underpinning ethos, but a lot of it boils down to the fact of being transparent, honest and sharing at all times, about listening and feeding back. And where there are things that we can't take action on, we need to be clear and honest about why not. And it might just be about timing. We're also being very clear that often in these sorts of exercises, you aggregate up, and in aggregating up, you might miss the one or two really key issues or really key ideas. So we're doing all we can to ensure that we're trying to listen to and value the contribution of every single person in this process. And the ethos has been all about co-production, co-design and testing. And whilst that's quite challenging in terms of pace for everybody that's involved, throughout this process, as soon as we've shared outputs, tested it and amended it based on the feedback that we have received, and that will continue throughout the programme. I shared the participation at the last board meeting, as well as some of the feedback themes, in terms of these were some of the sub themes that emerged from that feedback, and these were the longer term themes that were also fed back, and the aggregation of these has been undertaken by Clever Together. That was the external company that were working with us. The action plan is really, really key, and that's what I want to spend most of the time on today, if I can. And there are tangible actions that we can and will take in the short, medium and long term, but we can't do everything at once. So what we're trying to do throughout this is think, what are the things we can do immediately, and what are the other things that we really need to do, the big hit items. And when we've identified those big hit items, what do we need to prioritise to do first, and what's the sequence within which we do them? This isn't about a scattergun approach, but it's about having a strategic plan that gets built following all of those outputs, that will make that sustainable. And the other thing is really, really key is that lived experience and feedback gathered through moving forward is going to enable us to deep dive into identified issues and build sustainable solutions. And indeed, running through that programme, other issues have emerged, particularly issues perhaps about kindness and the way that things are captured. But we've also picked up some issues around transphobia and homophobia, which will need addressing and are being built into the action plan as well. So there are 5 big areas, and what we've put together in this action plan in the way that we have is tried to do it in a way that says, this is what we've heard from you, our colleagues. These are things we're going to do immediately, and these are the timetable in which we're going to do them. These are the areas we've identified for development, but we haven't yet given a date to them or a sequence, because we need to do that through the Cultural Transformation Board in March, subject to board approval today. And then the final area on the action plan is, how will we know we've got there? And a bit like the question that Sarah posed, what are the impacts and the outcome measures that we're going to utilise? And again, some of the feedback we've had from the last round of testing is we need to do more work on the outcome measures, and we need to really link it to the cultural dashboard and the people metrics, so that we have a better grip, so some really clear outcomes and objectives that we're going to show delivery. But in terms of leadership and management, there was some really clear feedback around the presence accountability of managers, their need for development. So the actions here, the longer term actions, are around really clear leadership and management development programs built around the behavioural standards framework, but making sure that just and learning approach, that inclusion and diversity, and also compassionate leadership are the golden threads that run through all of our leadership and management at Morecambe Bay. In terms of the next area, which is transforming HR, resourcing and training, there was some really clear feedback about how people experience the HR department, my department, in terms of what they would like and what they don't like. Some real feedback around how policies get applied across the organisation inconsistently. Some big issues about unfair recruitment practices, and I've already picked up on the agenda previously about expressions of interest, but also views around nepotism and cronyism, that we don't have fair processes. So within the action plan, there's a real clear commitment to drive an improvement approach within the people and OD function that gets linked to the national development around the future of HR and OD, which talks about a very different sort of HR department in the future. A real early win for me needs to be around fair and inclusive recruitment processes, modelled on best practice, but does link to the anti-racism work, and something around really utilising multi-source exit interview feedback to continuously improve colleague experience. So what are we hearing and what are we doing about it? In terms of culture and well-being, bullying and harassment was quite a big issue throughout the feedback. Something really around psychological safety and diversity and inclusion, and so some big themes and big issues. So the priority actions here, there's something absolutely about creating a psychologically safe organisation through a range of different interventions, but really also embedding our values and our behavioural standards consistently, and really pushing civility, respect and kindness, as well as this visible and inclusive approach to equality, diversity and inclusion. Fourth area picked up was around strategy and engagement. This was a particular area that we'd asked for feedback on, and significant support from the draft vision and the ambition, but an ask for greater involvement in decision making and policy creating, much better integration of community services. The community services voice was very, very loud in that they felt that they weren't necessarily reflected and integrated within the organisation. It's very much an afterthought, and greater voice and recognition for colleagues. So the actions here largely linked to the operating model review, but also really pushing that community services integration and collaboration, and through engagement also building a much more inclusive reward and recognition strategy as well. And the final area is around our workplaces, and I think quite clear recognition that we often talk about our workplaces not being great places for our patients. They need a lot of work, but equally they're not great places for our colleagues too. We need to do what we must to improve colleague working arrangements, including things such as relative basics, which is access to hydration, good nutrition, shower and changing facilities, a recognition of the new normal about working from home. So how do we implement that longer term approach to do that hybrid blended approach to working, improving our estates and developing those IT systems in a culture that's underpinned by coaching across the organisation. So I'm going to end there, and I'm sorry that was a bit of a whistle-stop tour. It is in your packs. What we're asking the board for today is to approve the outline action plan. It's not perfect, it needs work, but through the cultural transformation work program board, we will then build this into a strategic program to be delivered and monitored by the board as we move forward.
Okay, thank you, David. Seems fairly clear. Adrian's got a comment or a question, and Hugh as well. Adrian?
Just because I'm aware of time, just to share with the board that we discussed this in depth at the People Committee. That was a really open and honest debate, really, about the issues that have been presented, the transparency of how they've been recorded and documented in this process, which we were assured by, and just the commitment, really, in terms of co-development and co-design across the whole process, but particularly around the measures, the impact measures. And that's going to be the critical thing so that this plan's credible, and the Workforce Committee will have a key role to oversee that, working with the Culture Board just to ensure that it is fit for purpose and that staff see it as a credible piece of work. Thank you.
Thank you, Adrian. Thank you. You?
Yeah, I'm really pleased to see the level of information that's been collected to support this, but and I see that you've got some interim actions which are all fairly general in terms of commitment to do this and commitment to do that in the next couple of months. Then, as you said, the rest of it's an outline one, and there's masses on that right hand side in terms of areas to address, and I just had shades of having read the Becoming Anti-Racist paper, and then followed on with this. There's a comment in the Becoming Anti-Racist paper, which I think is quite important, that it said that we took a reset on that in September 21, when the board noted that though many improvement actions have been identified over the past year, few outcomes had been delivered. And I'm just very aware that we actually need to be very focused when we actually decide what are the key actions we're going to take. Otherwise, we'll drown in initiatives. And we have a history, don't we, of as an organisation, of drowning in initiatives and not really hitting the target. So I just think that we will need to have this come back to us when that initial phase is gone and the initial next line of work's been done, so that we can have a sense that what the key priorities are and how the impacts that we're going to measure link to those. Because at the moment we have a list of a lot of really nice impacts that we'd like to see, but they're just listed at the bottom, and I think there needs to be some.
Got it here.
Yeah.
Wise words. Do you want to respond?
It's just, that's the point, that exactly the point Dave's made,
Yeah.
which is we need to spend a bit of time as the Cultural Transformation Board, because whilst the question is the right question, the way in which we prioritise is as important as doing the prioritisation. So we want to do that back with our colleagues and be really clear, as Dave said, if there's something that we're not going to be able to do, we are really articulately be able to explain why and where it sits in the priorities and what we're doing first. My offer, Chair, is obviously with Dave in his current role, has a leadership role in pulling this together and leading the programme. Ultimately, for particularly culture and strategy, that sits with me as the Chief Executive. So when we do present updates to the Workforce Committee, I will commit to coming to the Workforce Committee to kind of, as the Chair of the Transformation Board, to help present and kind of answer any questions around that, just to give it that visibility and priority.
Right. Thank you. Like I say, I'll repeat the wise words. I'm sure the People's Committee will take that on board as well.
Yeah, thank you.
Okay, thank you. David, we're asked to approve the action plan. Looking around, everybody's nodding, thumbs are up. Thank you. Thank you for the presentation. I know we'll visit it again in aspects of the workshops this afternoon. I know the People's Committee is scrutinising it. Okay, we'll move on then. Item 232, Integrated Care System Update. It's a really, thank you, Chief Exec, it's a really good paper, a really good summary of the current situation of the ICS. I'd recommend people outside of the trust should read it. Actually, it's a really, I commend you for that paper. Anything you want to highlight on it?
Nothing, only to note that we need to spend more time as a board, as I said in my Chief Exec's update, on the next phase of the system reform agenda, both with Bay Health and Care Partners, ICB and the Provider Collaborative Board. So I know, Chair, you and I are talking with Paul as to the work plan for the board over the next 12 months, but we'll spend some more focused time on that strategically over the next period, but nothing more to add, Chair.
Okay, I think the report is self-explanatory, so we note it. Colleagues happy with that? Okay. Item 233, Executive Medical Director update. We asked to consider your report. Jane, anything for us, please?
No, I can be brief. The report is there. I think for me, it's really encouraging that whilst a lot of trials were stood down by the trial organisers during COVID, there was a good amount of COVID-related research, and we took part in a lot of that and recruited quite a lot of patients to it. Certainly in the region, we were a very high recruiter. As we learn to live with COVID, research activities now returning, and we've returned to about 85% of the previous activity, which is excellent considering that we're also still doing our COVID trials. I always like to look at other places to see how we're doing, but it's very difficult with research because everywhere has such a different offer of services and capabilities for it. But I think historically, if we look back at things like national patient experience surveys, we score higher than average in things like patient involvement in research, which I think is a good indicator. So I think we seem to do very well for a trust of our size in terms of research. And I think for me, it's really, why do we do research? We do research to make things better for patients. Patients love being involved in research. They feel, it's a very altruistic view that they like to feel that whatever suffering they are going through or whatever hardships they're going through, they can try and use that to help others not be in the same situation. So I think having a research program that is really well focused and is delivering is a really great indicator for patients of our intent and for quality, really. We've got a team who have got a clear strategy of how they want to improve things going forwards, and I think the one thing they've highlighted is that they have very willingly and very graciously moved on a number of occasions through COVID, but they don't really have a permanent home, and that's something that we need to support going forwards to allow them to flourish and deliver the best that they can.
Okay,
and that's as much as I need to say.
Yeah, we note the report, colleagues. I think I'll just add on, Jane, that I know yourself and members of the improvement team are talking to colleagues at the medical school at the University of Lancaster around research developments there. And just to note in the board, I'll be meeting the Vice Chancellor at the University, Lancaster, to talk about a refresh of our research and development strategy and our wider anchor links with the university. So it's just to note that in the board report. Okay, thank you. Item 234, Lorraine, Head Governor's update. Would you like to give us an update, please? Hello, Lorraine. You might be on mute.
Can you hear me now?
We can hear you.
Yeah, I'm taking it that this is my report that I'm giving you now.
Yes, it is.
Because one says update and the other paper says formal report. Anyway, this is my first formal report as the head governor to the board of directors. And I'd like to thank everyone for the support that I've been given since I got appointed. On behalf of the council, I want to place on record that our thanks to all the staff for the tireless efforts to provide safe care to all our patients as the pandemic continues. Congratulations go to Sarah Rees on her appointment as a non-executive for the remainder of the term of office for that position held by Rachel Isber. This has been ratified by the council. On behalf of the council, can I thank Bruce Jassy for his contribution to the board and wish him well for the future. I'm sure Bruce will remember me as that woman from Bentham, North Yorkshire. The nominations committee is leading a recruitment and selection process for a new non-executive director. Bruce, Pauline Preston and I have carried out the chair's mid-year review and spoke with David Florey to get an external view of the chair's performance. The outcome was positive and will be formally reported to the Council of Governors The chair has held constituency meetings within the governor's areas, and these have been quite well attended and will continue. The governor's also held a development session. This was about a fortnight ago. This was the first opportunity for a face-to-face meeting, and we explored what the priorities for the council would be moving forward. We plan to progress this work. The governors have also received a briefing from Richard Sachs on the Care Quality Commission, niche and Royal College of Surgeons improvement plan. And that's my report. Thank you very much.
Thank you, Lorraine, in your capacity as head governor. Looking round, there's no questions, so we note your report. Thank you. I'm conscious it's 12:32 now. Items 235, 236 and 237 are in front of you to note. Just checking, Paul, no urgent business? No. I've just
not been allergic to anything, Mike. No.
Thanks, Paul. One item I hope won't take too much time. I'm going to ask Ben. Are you there, Ben? Ben Maiden, staff side secretary. It's just staff side chair. My apologies. Ben, we spoke the other day and you said you'd come to the board and give us a very quick update for us to note on the staff side position on the pathology collaboration.
Thank you, Mike. So, yeah, for the note in of the board, so Mike and I met earlier in the week to discuss this. So at the last board, I informed you all that the staff side position at Morecambe Bay was to lodge a grievance around the pathology collaboration under the grounds that we believe that the TUPE date was too premature. Now, since then, we've actually amended our grievance to also add that we feel that the board has been misled in the narrative around the pathology collaboration. So a few weeks ago, the board was sent a pathology collaboration update, and what we feel as a staff side is that the update was a very rose-tinted picture of the narrative that failed to include some key points of concern. So that report failed to mention the grievance lodged by Morecambe Bay, and it also failed to mention the grievance lodged by Blackpool Trust. And it's come to my attention during this meeting that East Lancs are now also planning to lodge a grievance. It also failed to mention around staff side's request for status quo during the grievance hearing. We are asking that the staff are not TUPE'd over in the summer if the grievance is still in the process of being heard. So we've already said to you that we think the TUPE date is premature, and I'd say that we think this is by about at least 12 months. But there's also been concerns from colleagues and our members around redeployment. If they have to go to the new host trust, redeployment opportunities will be limited to the host trust. They wouldn't be redeployed here in Morecambe Bay. And we also felt that the report that was sent to the board failed to recognise the risk of staff leaving prior to the TUPE date. We've had a lot of members come to us saying, you know, we are considering going elsewhere now. So equally, that is where our position is as a staff side. What I would say is that the staff sides across the ICS have all agreed that we won't sign the terms of reference for the pathology collaboration until the grievances are heard. And we would hope that a true picture of the narrative will be presented to the board from the collaboration's next update. And equally, I just want to thank Mike as the chairman for his conversation early in the week. It was very reassuring to know that, you know, he sits regionally on the pathology board and that some of these concerns have been raised there. So thank you, Mike.
Thank you, Ben. I am aware that other trusts are doing that. I'm aware we're a public board, so we really focus on our own trust here. So I'll leave those trusts to deal with their own business. Thank you for giving the staff side view, Ben. We note that in the board. As you say, both myself and the Chief Exec, Aaron, are on the Regional Pathology Board, and we are aware that there are discussions between the Pathology Board and the staff side representatives. So thank you on behalf of the union for giving us that update, and we will note that in our papers. Okay, colleagues. All right. Can I just check with everyone that you felt we've dealt with business this morning? There's no other outstanding issues, that you feel that we've investigated assurance issues sufficiently well? I'll close the meeting then at 12:36. Thank you. For those of you in the private board,